Hello, I'm Dr. Ted Truitt, and you're watching this video right now because you're interested in having an in-office sinus procedure. The procedure that you're thinking about having is a procedure that takes about 30 minutes or so to do, but it's usually about an hour of time sitting back in our procedure room, getting decongested, numbed up, and anesthetized for it. Usually you'll be offered some medication to help relax you. You'll have some nasal sprays sprayed in your nose by one of our nurses, and then you'll go back to our procedure room where the physician will talk to you a little bit, and then you'll be just relaxing while we put some cotton in there that really numbs up your nose well. After some time with that in, then we'll go ahead and do some brief injections. Usually you don't feel those much. And then we'll be able to get started with the procedure. So the procedure, 20-30 minutes of working on them. We might use a balloon to open up your sinuses some. That balloon does not stay in your nose. That balloon will be removed after the sinus pathway is opened. Usually patients will feel a little bit of pressure during that, but there won't be a lot of pain. They'll hear some noises, and the physician will warn you when to expect that. Oftentimes patients won't remember much from the surgery because of the oral medication that we give, but in any event, you'll be awake and alert during the procedure, and you'll tolerate it just fine. After the procedure's over, depending on how much work we did up there, you'll have some bleeding from your nose. We'll place a gauze underneath there. That gauze will catch any blood that wants to drip out of your nose. That bandage will fill up with blood maybe 3 or 4 times during the course of that day and that night, and you just change that dressing as needed. I would not worry about any bleeding to that point where it's 3 or 4 times a day, that first day that you need to change it. After the first day, it's rare to need to wear that bandage underneath your nose. The pain after a procedure in the office is a little less than under general anesthesia, and you should be able to get by with ibuprofen and Tylenol, although the physician may write for some stronger medications, but I'd encourage you to try to get off of those meds, as people typically feel better when they're not on narcotic pain meds. The first night, patients will often complain of drainage down the back of their throat. That might be the reason why they're even getting the procedure done in the first place, but that's a normal part of healing. So expect it to actually seem like you have more drainage the first day. You may even feel like your nose is more congested. When you leave the procedure, oftentimes you're breathing pretty well and you're feeling really good about it, but then you have a transition time that needs to happen, and that can be anywhere from 1 to 3 weeks afterwards. There will be specific instructions about when to start what nasal spray and when to start rinsing out your sinuses. The sinus rinses are going to be very important for you after this procedure. It just helps your sinuses recover quicker. Those will usually be done twice a day, and the doctor will tell you when to stop doing those, but you'll be doing those all the way up until you see your physician back. Usually the follow-up's a couple of weeks afterwards, and we'll look up there with a scope and make sure everything is healing well. If you had your septum fixed in the office, sometimes we will put splints in there afterwards, which it's pretty uncommon in the office to have splints put in. But if you did have a septoplasty done, it may take you a little bit longer to bounce back from it. The procedure is really an easy procedure to get done, and the recovery is not too bad, and I don't think you'll expect many difficulties in the days afterwards.